Tell Molly to come in with the coffee. Tell Molly to come in with the coffee. You've got a bloody coffee,
I
Claire.
have got a coffee, yeah. And my second one today, Trinny.
Oh my God, what time did you get up?
6.
Did you?
Yeah.
Claire's got the most amazing dog. We're going to get on skincare in a second, but Claire's got the most amazing dog.
Who doesn't like to sleep in?
Yeah, really like say, hi Claire, I'm up now. What are you up to?
Yeah, exactly.
I mean, like a horse, like a mini Shetland horse.
Or a little sheep.
A little sheep.
She's a sheep. She's a Labrador.
No, she's a big sheep, I'm afraid. She's not a little sheep. I think sheep a lot smaller than her. Today what we're going to do, because we've had so many requests on it, is we're going to talk about routines. We do this every few months and we get a build-up of a ton of questions about this is my skin, what's my best routine. Now, on Trinny London, we do Match Me Skincare. It's always the best way to do this because you're going to put in all those details. Because I think skin, and we discuss this a lot, Claire, is so subjective. So how you view your skin and how Claire and I would look and take your skin apart might be different, but we've got to go with how you feel about your skin and what you tell us to kind of diagnose what it really is like. And sometimes there's a barrier, and we did design Match to Me so that we could kind of circumnavigate any issues and be able to ask you questions where you didn't quite know why we were asking that question, but it's going to give you great routines.
And it also really depends on how much you're willing to invest time-wise into your routine. Like how many steps.
Yeah.
Like, do you need an easy, quick fix, or do you actually want to put the time and effort into
but
doing
let's
different
talk
steps?
about the easy, quick fix, which might be wake up, don't wash your face. Okay, easiest quick fix. Wake up. Okay, how many people? Let's get the answers now. This is the honesty lab. How many people wake up and don't cleanse their skin and throw on some moisturizer or SPF and then go straight to makeup? Just like put your hands up, we want to get a feel of the room,
exactly.
all right? And then, so you've got to answer that question first. So we're going to wait for that answer to come in, otherwise I'll ask you another one and we won't know which one it's from. But how many of you are that kind of person? Because I think what today is also about is adding more things into routine doesn't actually add on more than like 3 or 4 minutes. You know, max. Yeah. It's just a question of the mental energy you put into thinking, I want to really improve my skin, and the belief, guilty, I love it. Yes, you see, this is it. This is what we got in the room. I think it's so important to read the room first, and as we can't actually see
Well, what is great is, Trinny, is that there's not too many hands, so I think people are
they're
a
still
little bit
doing
more,
it, darling.
There is
it's a
few.
catch-up.
Okay.
It's a catch-up, all right? No way, yuck. All right, darling. But yeah, you know, and I think it's Happy Diwali. I think it's very important because what we're going to do is balance out and say, you do the least. And I think many people, Susanna included, my lovely Susanna, did the least because they had amazing skin that looked after them. And then we hit that delicious perimenopausal stage in our skin, which is where our sweet spot, any person over 35, we're really, you know, keen to look at their skin and help it. And suddenly 35, 40 things happen in the skin, which mean that your skin stops looking after you. In fact, somebody, I watched can I digress for a second? I watched a video yesterday by somebody, I'm not going to say who, but I sent one of their videos, and it was so scaremongering around, oh, do you look in the mirror and think, I hate myself? Literally, I hate myself, I hate my wrinkles, I hate my whatever. And this person talked about zombie cells.
Zombie cells, yeah.
Yeah, so do you know what zombie cells are?
I do, yeah.
Okay, so zombie cells are interesting. It's like when we look at why we age, they sort of made out this horrible zombie, which is a cell which has died, stays in your skin, and it goes around and it kind of damages everything. And there's only certain things that can get rid of zombie cells. And one of them was the thing, obviously, he was selling.
Of course.
Of course. But people will package it up in different ways. Some of you will go down the path of life and not worry, and you'll age as you age and not worry. We believe we want to give you the best of what you can have at any stage in your life. And that's your personal choice. So what should we start with? I have a coffee and maybe a little something to eat first. Great. We like that introduction. Jane, good morning. Jane, what are you saying good morning for? You are miles away in Canada and it must be 3 a.m. Obviously, the northern beaches in Sydney are awake because it's their evening. Lovely. So I think we can talk about general skin and what, you know, if you're oily combination, I think that was the old-fashioned diagnosis, you know, is
it was just about skin type.
Just about skin type. So if you have it's just a skin type and you have no other issues like pigmentation or really worried about your wrinkles or congestion in your skin or sensitivity, we think there are specific routines which should contain certain ingredients.
The way I always see it for skin type, and this is like simplified.
Yeah.
I pick my cleanser and my moisturizer based on my skin type.
Yeah.
And then I pick the other products in my routine based on my skin concerns.
All right.
The
That's
things
good.
that I want to tackle.
Yeah.
It's just an easy
That's
way to
great.
think about
All right.
it, yeah?
And one thing here, just because it's like, I love this, but I think it's good. Kylie, do you put sunscreen on first? I feel it's the best skincare, especially in Australia. Sunscreen is the biggest preventer of aging of skin more than anything else, but you don't put it on first unless you're talking about waking up, doing nothing and just going straight to makeup. Then it would go on first if you're that kind of person that we've been chatting about, the kind of gently lazy, let's just put some water on our face and the first thing we put on is sunscreen. If you're going to have a routine in the morning, it will be the last thing you put on in your skincare routine. So should we start then with the ingredients we're looking for? If you have a normal skin, you've got a sort of average pH balance, which means it's not excessive oily or excessive dry, and you want to just keep it healthy.
Yep.
Protect the microbiome.
Yep.
The routine is going to contain.
You want to use it like quite a gentle cleanser, yeah? So I think there's so many cleansers out there that are too harsh, and what they do is they deplete the skin of actually its barrier. So all the lipids that are in your skin that give you that waterproof, that protection, a lot of cleansers are too harsh and they do that. So something like a cleansing balm is ideal.
We have Be Your Best, which is our Trinny London one. I'm just going to show you as we do this, each Trinny London one, just to give a reference to what type it is. But when we talk about a balm, this is really 101 of skincare, isn't it? It's a texture which will be like that, and it will allow you also to massage your skin. And I really love facial massage. I do it a lot, and I've been doing a lot of facial exercises the last few.
And it gets the blood flow going, and it just like energizes your skin.
Exactly.
So you get 2 for 1.
And you're really stimulating, stimulating. So you can then add water. Some of them transform. Ours transform, so when you add water, it turns white, releases enzymes. But there are others out there, different price points. But it's that balm cleansing concept that we're looking at with the normal skin. And every type of skin should have, yes please, every type of skin should have cleansing. I'm just going to say, cleansing in the morning, we talk often about the witch's brew, Claire, but
absolutely,
you release toxins overnight, your body's healing, it's regenerating, it's going to release shit. And it comes to the surface, and some of you might notice it as a sort of film on your skin. You might think it looks quite dewy, but in fact that's got to get off your skin. With water, does it get off? I don't think so,
No, it doesn't.
So I think we go through like cleansing for different skins as opposed to a whole routine for somebody.
But it's also like what format you like. So you love so at night time, I love to have a balm and really have that kind of massage moment and really feel caring for my skin. In the morning, I like to splash my face with water.
You do,
and I literally will always use a wash.
A gel wash.
A gel cleanser is what I need in the morning. So I don't feel in the morning that I'm not awake if I haven't done that.
I agree, and then some people like to wash their hair in the shower and things like that. Now, gel cleansing goes from really shitty to fabulous, and I'm going to put my views on this. I think gel cleansers can be very stripping of the skin. So you have to be so careful what you get.
Precisely,
they can be stripping either because they have, like a shampoo can strip your hair, they just have too much foaming in them, so that actually dries your skin, just the foaming.
So they're like the surfactants, that are cleaning the skin. They can be very harsh. That's what I was saying to you. Like a balm is very rare gonna ever like dry your skin out. It's actually adding something positive to your skin, whereas a wash or a gel cleanser is 100% potential of stripping your skin.
So,
and then you will know that because your skin will feel really tight and like dehydrated, where you know I have to put something on.
So if you're using a cleanser right now where you kind of can't wait to put the moisturizer on afterwards or whatever you put on afterwards, really question, is that the right gel cleanser? Because a gel cleanser should just get your sort of pH balance levels better. So if there's any extra oil, it's removing it, but if your skin is normal, it's just leaving it very shiny clean is how I describe it. So what is, if there's too many sulfates, I was saying, but some people have quite strong AHA cleansers or 4 acid cleansers. We use in Better Off an AHA and a PHA. So we use gluconolactone as our PHA and our AHA is lactic
acid.
Soft acids, lactic smaller, so it goes deeper, but these acids go on, help the cleansing process, and then you're washing everything off. So that's, dry and dehydrated skin. And let's just also talk about what that means for us, dry and dehydrated, because I think everyone feels differently about because you're putting dry and dehydrated in the same bucket, whereas I
When
think
actually they're very different.
they're so
issues.
different.
Yeah.
And dehydrated is you haven't got enough water in your skin. Dry is you haven't got enough oil in your skin. So
And it's awful when you have both.
yeah, because you can have both.
You can absolutely.
You can have both, and that's somebody who probably doesn't drink enough water, loves a lot of coffee, and also is not hydrating their skin
and
with
the skin
oils.
and the products they're using are too harsh.
the
The thing is, right, which I think is amazing about what we've done on our cleansing is that cleansers can actually transform your skin on their own.
Just on their own, yeah.
And it's because you're not putting your skin out of balance. You're not actually stripping all the barrier out so that your skin is like already
having to
starting the
repair
day.
itself.
Yeah, so the skin is already on the back foot, and then everything that it has to face in the day is actually then it can lead to dehydration, it can lead to dryness, it can lead to spots, it can lead to sensitivities, it can lead to rosacea, all of these things just from the cleansing stage.
Yeah.
So the fact that we actually respect the skin, we clean the skin, and we keep it in good balance, people are actually seeing really positive benefits just from a cleanser.
Yeah.
And
And
you
what-
wouldn't think, and this is why investing in your cleanser, not just using
I
a cheap
agree, I
stripping
agree, I
cleanser,
agree.
it actually, you can simplify your routine by just using good quality products. Yeah.
When we launched Trinny London last February, we launched cleansing first for a month because everyone who then came along, we wanted people to just see switching out your cleanser and notice for a month the difference in your skin. And I think that really helped people to understand
Cleansers do make a difference.
cleansers make a difference, and also that, you know, if I went to Selfridges yesterday, Claire.
Yeah.
Or not yesterday, Sunday, with somebody because we're expanding on retail. We're not going Selfridges yet, but I'm just looking at what other people do. And I looked in the main hall, and I thought, and that's where those big brands are. And I thought, you know what? I know from our lab ingredients, how we make things, our skincare is better than anyone in here. I just knew that emphatically. Then I went in the back hall, which is the apothecary, where you've got a mixture of sort of niche brands and doctor brands, etc., etc. And I think there was only one other brand there that I thought, I know the level of ingredients they put in, how they do it. And it was so amazing. I'm not just like, this is not a boast. This is just the joy after so much hard work and knowing what's in ingredients. And when you want to understand ingredients, there's very interesting little tricks that Claire told me that I put in Fearless. And I'm just going to digress because there is one, I can't remember the name of it, but it's, if you buy my book, you'll get this little secret trick. But on the back of any box, you'll have the ingredients. And this is a way, when we get onto serums especially, you can test, is what your serum's telling you it would do going to do it, or is it just marketing? And we're going to get onto that. We'll get onto that with serums.
And it's such a shame that so many brands are putting things in for marketing and story, and that's something I think you were very passionate about from day one, is that we are actually going to make products that are going to make a difference, and even if it's going to cost us a fortune to do it, I think that's the whole key, is that we have tried to keep true to that.
So we're now going to go on to, dry and dehydrated skin. It would be in the morning a balm, and then in the evening a balm, because your skin is really suffering from lack of nourishment and water. So you're not going to go near a gel cleanser. Oily skin, you're going to go right for gel cleanser.
I think so.
Yeah,
a lot
I
of
think
people
so
with
too.
oily skin generally feel like they want to wash.
You want to wash. You feel that excess on, you want to get on. Combination, which in our world is that you might have oily here, but you might be drier here. You need a combination of the two because we want to sort of balance out what's going on in your skin. So we like in the morning, perhaps like you do.
Yeah, because I have kind of this normal combination. I don't have very oily skin, but that's why I use a balm at night, and I'll double cleanse with my balm at night, and then I will use the gel cleanser in the morning.
So that's cleansing. When are we doing an eye cream at Trinny London? We've got at the moment, I'd say in the lab, Claire, we've got about 12 things we're working on, haven't we?
Trinny, a lot more than 12.
Well, I'm just saying in the next
in the next
period of time. We're very cagey here. But in that, there might be things that might be classic things you think about, but there's so much we have to do to make it have a point of difference. So I don't know how long it will be to get to any of the things that you see as a classical extension of our range. We won't bring them to you until we feel, my God, we can talk about that like it's never anything that you have bought so far in that category. And as you all know, I've never felt that eye creams, did more than if you take your serums up to here. So it would have to be so much more. That's just saying, yeah. And then the last So that's cleansing. So are we all there on cleansing? Are we all thinking, I'm prepared to think about cleaning my skin properly? There's Tara in here. Hi, I have dehydrated skin. Can I just use the balm cleanser, or are both definitely required? I'd say you can just use the balm cleanser.
Well, the joy of the balm cleanser is you can use it in different ways. Yeah.
You can use it dry. You can add water, and you feel that watery moment. So you can definitely do that, and that would be fine. Pip, hi Trinny. When Plump Up refill available, need to use with my microneedling.
Good question. I think very soon.
Yeah, I think very soon too, actually. I think,
must check that,
Well, if we can find that out, Faith, whilst we're on the live, that would be great. It has been, obviously, it's one of our top sellers, a serum.
Someone can message Valeria.
Yeah, that would be really great. All right, now we're getting on to, we're having a discussion today, if you're just joining us, about skincare routines and what ingredients should be in those routines for what type of skin you have. And it's just going to help you to really understand, do I do this section well? Do I need to think about what I'm using in that in that step of my routine? Jackie, I've been using Better Off for about a year and I absolutely love it. The best cleanser I've ever used. Thank you so much, Jackie. Oh, there's an essay now. Be Your Best, Tiptoe and Plump Up, Energize Me and Bounce Back. I bought the... Last week, I bought the small size, well, this is the set then, Be Your Best, Tiptoe and Plump Up, Energize Me and Bounce Back. And I love them all. I'm 55 years old. I have some wrinkles and some dehydration, but I can also get some cystic acne. You're such a classic skin. I know that skin so well. Your skincare is a godsend. Thank you so much. That's so sweet of you, Jackie, in Sydney. I know, we can't wait for the SPF 50 to get to Australia as well. I just have to say, I feel. Okay, sensitive skin, Cara. That's a good one. I think we have to first of all define levels of sensitivity, because it's also, we need to, if we were doing a routine, and we can just do one routine now, a full routine, because it's the shortest routine for sensitive skin. So I'm going to say this is sensitive skin that doesn't like really active ingredients, but can have a tiny bit of fragrance. Yep. Yeah, I'm gonna define it as.
There's definitely different levels of sensitive skin, and everybody's interpretation is also different.
Exactly. Yeah. So if you have sensitivity where you literally can't put anything on unless it's fragrance free, we are not the brand for you. And there's brilliant brands like Avène and La Roche-Posay that have very good for super sensitive skin. Thank you so much. Claire, you've got another copy. You
nice.
Can't have it there.
I can't have it there.
I mean, she'll start to jump up and down like her bloody dog first thing in the morning. All right. But if you have skin which is just sensitive, the joy of the routine we're going to talk about is that we can actually move the dial on helping your skin with aging. That's the joy, because most people would just put you in a corner and say, here's some nice things, but they'll smell nice and they're not going to do anything for your skin. Hydrated. All right. So our favorite routine is these three. It's just three things. And I would actually, are you going to add in tiptoe in? Yeah, I'm going to add tiptoe in. This is very interesting, because as we get on to exfoliation, a lot of people with sensitive skin are told you can't use AHAs and BHAs, which you can't, but you can still gently exfoliate your skin. So you'd cleanse your skin with Be Your Best Cleansing Balm. Then you would use what many of you who might still use a toner. Still, it might be rose water, it might be that sort of interstitial before you moisturize, or hopefully before you use the serum, is the area we talk about exfoliation. And you're going to feel, though, it's like a toner. So tiptoe in is a liquid like that. Get some on. A little bit gloopy. You put it on and you keep it on. So it's just going to go on, and you feel it's got a lovely texture, tiptoe in. But the ingredients inside are the phenomena for sensitive skin, because we can talk about the azelaic acid as well. But take me through why we think it works.
These have got polyhydroxy acids called PHAs, and they're super, super gentle. So they take their time to penetrate into the skin. So they gently exfoliate, but they also hydrate. So they're humectants. So they also bring all that moisture to the surface of the skin. So we have actually developed this formula to also help to reduce, to build the resilience of the skin.
So strength in the skin.
So I have quite sensitive skin, and a lot of active ingredients don't always work well. But the fact that I use tiptoe in every day, twice a day. and now I have been for years, and my skin is actually less sensitive. And that is the thing around building the resilience. And you're gently. I also don't get breakouts like I used to. I also have a clearer skin than I had, and I'm just doing it in a gentle way. So you can go in with hard hitting acids, or you can just take the easy road and do it nice and slow and nice and gentle, and that's what tiptoe in is about. Hence even the name.
Hence even the name. And also the key here is that you can actually do something that's going to help your skin. It's not just you've been put in the corner. So the next one, which is our best-selling serum, is Plump Up, and this is amazing for every skin. But the great thing about Plump Up as a serum, and this should go on as a serum before you put anything else on, is that it's so effective and yet not irritating in any way.
So this one is packed with peptides. So we've got 5 different peptides in here, and we also have different forms of hyaluronic acid. So
let's talk about peptides in a way, and why you could look at other brands as well. If you are not into Trinny London, just look at why we love peptides and look for them in other brands. But for us, I mean, they are in a few of our products, but why do we love peptides and what are they doing, Claire?
So peptides are basically switching on all of the collagen and elastin production in your skin. So the ones that we have are called signal. So they are signaling the production of collagen and elastin. They are super, super, super gentle, but actually super effective. Now we have this complex of 4 peptides, which is super, super expensive, really, really effective. And I think the research that's been done behind peptides is
amazing. I mean, we're so excited by peptides.
So the fact that this and like the clinical studies that we've done on Plump Up show like amazing results, I think this is like a true winner, and it's so easy to use. And you also get this plumpness with your skin. You get the hydration, and everybody that uses it absolutely loves it. So it's great. It's also fragrance free. Anybody, any skin type can use it and really see amazing benefits. So it's like reducing wrinkles, fine lines, it's firming the skin, it's lifting the skin, it's plumping the skin. You've got 24-hour hydration, you know, so there's so many benefits.
And my favourite things are when we did the clinical trials, and Claire would always say to me, you know, if we see a 20% improvement in something, it's really big. And I think that it's really important to understand the difference between consumer trials and clinical trials. So consumer trials is a woman who's you give it to, and we do them with 100 to 180, 200 women on different things. It's like, this makes me feel X. So it's their feeling about how they feel their skin is. Whereas a clinical trial, we take a number of women and they use no other product, and they go to our
testing
laboratory, and their skin is measured by different ways, and then they go back in certain periods of time. So with Plump Up, we did this over 2 months?
3 months.
3 months. And we had these results where we had, in the firmness of the skin, which is like how much that sort of infrastructure is still working, and basically a stronger collagen elastin, it was a 64% improvement. That's a huge improvement. This is where you thought we'd get 20%. And then in the elasticity of the skin, which is like when you push into your skin, how quickly it pushes out. So if you do this now with your skin and you push in and you feel it's a bit sluggish, bouncing out again, these are the types of ingredients that you need. So look for ingredients in a formulation that have peptides and signal peptides. Because that's where we've seen a 63% improvement when we did the results. So we use quite a high
those
percentage.
Results are insane. As I said to you, I've been developing products for 20 years. We had to double, triple check to make sure, because I was like, this is unreal. It's such a good product.
It's like, so in that routine, and then you're going to finish off with Bounce Back, which is our moisturizer extraordinaire, and this has 4 of those peptides in it, but also other ingredients for fantastic hydration of the skin.
Now, I would say if you can be sensitive in any skin type, because sensitivity is more of a condition than a skin type. So if your skin is quite oily, for example, or a little bit more combination, you might want to use something like Energize Me. And that's why I always say that your moisturizer and your cleanser is kind of picked on your skin type a little bit. And like Energize Me is that kind of water-based, you know, really refreshing, great for the summertime, especially for anybody, but you might use that as well. So you can use both. And what's great about Bounce Back is also that it's nurturing and nourishing, but still quite light.
Yeah, I agree.
So actually, even
you
if you have
don't
oily
feel
skin,
the weight
you can,
on
you
your
don't.
skin.
So you can use it no matter what age you are, but it just depends also like what textures you like.
So that's 4 stages of routine. You know, sensitive skin people might have thought, you know, I'll spend 2 minutes cleansing my skin, but that's your routine morning and night. And it is something that I think we do in a set. I think we might do them in the set for, I think we do it with Energize Me in the set. It's called the Plump Up set, maybe, for our mini sets. So think about it. If you're watching and you're thinking, do I actually want to upgrade my skincare routine? There it is, there. That's it. And it's called the Plump It Up routine. And it is with Energize Me, and I think I love Energize. I mean, I've been using Energize Me in the day, actually, a lot more recently. Yeah. So that is exfoliation. We've done a simple routine there, but we've done cleansing and exfoliation. Now, the role of serums in skincare. And there are so many serums out there. I think serums is the most confusing thing because there are millions of serums and you can kind of be drawn in by the results people will say in serums, you know, giving you firmer skin, bouncier skin, softer skin, younger skin, anti-aging, anti-fucking caging. You know, I don't love that. I think it's how can you actually improve the skin you have and not define yourself by age.
And not try to look 10 years younger. It's about just looking great.
It's about looking full of energy and looking in the mirror and feeling you've got skin that's well, you know, instead of skin that's tired or dull or, you know, we want to bring your skin back to life if you're feeling you've lost it, you know, and I think that's when we speak to women, that's their kind of, I feel my skin's lost its va-va-voom. So that's, you know, things. So, now, Alicia, I didn't get along with Boost Up, so currently I have C ferulic. Do I put Plump Up first? You put Plump Up first. You want to put in, what's really important now we're getting on serums is the levels. So Claire,
the lighter
the texture and the more watery first. So lighter and more watery. The balm doesn't come into that because you're taking it off, but once you put ingredients on that are going to stay on your skin, like exfoliations and serums and moisturizers, it's the thinner the texture and the lighter the texture and the one that's more. So these are all, apart from BHA actually, but these are water-based. BHA is water-based, but it's an oil acid. It sounds confusing, but generally the formulation is sitting in as a more water-based formulation. So that's first. Now, you've got different serums. We have 4 serums, but I'm just going to talk about serums as a category because you'll have serums that people will refer to as antioxidants. You know, they're full of antioxidants, and those are things that can contain things like vitamin C. They can contain ingredients that are going to deal with what you call free radicals on your skin. Now, free radicals on your skin could be going back to talking about those zombies, but free radicals are all those things externally that affect your skin and break it down. So it could be smoking, pollution, wind, sun, what else? Stress
causes free everything, like living.
Thanks, Claire. That's just great. Like, living, all right. Living changes the skin. Of course, it does. It's very true. So you know, there's ingredients that they might call antioxidants, but I think that's confusing if you have an antioxidant serum because I don't think it's telling you what it would do for your skin.
Because you don't directly, because it's like there's so much free radical damage out there, and antioxidants are kind of preventing that damage from happening, and more damage is coming in all of the time. But it's so subtle that it's not like it's just repairing one piece. It's just this generic thing of you need antioxidants. You need it in your food for your body to also, because you've got free radical damage everywhere, not just on your skin, and you also need it in your skincare, but it's not something that's actually very measurable. So we never say that just because I have an antioxidant in there I can measure reduction in pigmentation, but I know that that's helping fight the battle against pigmentation. I have to put other things in to actually reduce it. So you need them, but they're not like directly gonna measure a difference.
They're not. So I think what we'll do first of all is we'll say daytime serums and nighttime serums because that's easier. So what do you use in the day that's going to help you, that will work during the day and also work with what you're facing what your skin is facing during the day, and what do you use at night when your skin is at its best place to absorb things because it's not fighting the day, so it can really regenerate. And what ingredients are you going to give your skin to accelerate that regeneration? That's kind of the easiest divide, isn't it?
Absolutely.
So daytime for us is about things that add extra layers of hydration, which is like Plump Up. So that's a daytime and nighttime serum, but also vitamin C. Now we have, and the ladies mentioned there, she went to see for it, we have a very strong vitamin C. And this is something where Claire and I came out, this is my fault. I will claim all responsibility because I wanted a really strong vitamin C because I've had pigmentation, I've known what it's been like, but it's not for everyone. It's for a resilient skin. So if you have vitamin C, I think also what's important, I'm not going to put these on in the right order, so I'm just going to show you, we're pretending but I'll show you the texture first of all. This texture, it's very unctuous, it's kind of feels, you know, nourishing. It feels a little bit like a balm, but I never put it here. This is the most sensitive part of a skin, and I always put it where also I have sun damage. And to me, sun damage is here because I, you know, in the past use SPFs and I would sweat, and that, you know, a lot of people have pigmentation here and also here at the side because we might just do this and we might not get it right to the end, and slowly we, you know, over the years, over my years in the sun, it had sun damage. So this is where I always have pigmentation more here and here. So that's where I place it because it's 30% ascorbic acid. I think everyone should use vitamin C.
100%.
Now we are thinking about, would we bring out a vitamin C that more people could use, because we've gone in at the deep end here, and that's really at the deep end. It's like very strong.
Yeah.
So it's one of the things in the lab. We'll just say that, won't we?
Yeah, absolutely.
It's one of the things in the lab.
We are definitely working on it. But the key is that, like, there's so many vitamin C's in the market, and a lot of people are put off because it's very tricky to formulate with. The textures can be like oil slicks on your face.
Horrible.
Just feel, or it could just be really irritating.
Yeah.
It's one that is not stable in light and in air.
Yeah.
So we have to formulate it a special way, and then that way can make it not a pleasant.
Yeah.
So we are definitely looking at vitamin C's, but just
we
it takes
need
time.
it,
And this is the thing, is we want the right type of formula.
And there are a lot of, this is where, and I'm just going to state this, there's a lot of companies that talk about vitamin C and they make it orange or they have oranges near it. It's not from oranges, by the way.
No.
But it's where you're going to be swizzled the most. I'm just going to say that. So in terms, there might be some beautiful textures out there which are fabulous, and you feel, oh, wonderful. They might have some light reflection in, so you're going to feel that glow, but the glow is cosmetic. So just be aware.
And if the
what you're
vitamin
looking
C,
for.
so, you know, so for any vitamin C, there's so many different forms.
Yeah.
But they're all going to have something like ascorbic or ascorbol. So the ascorbol is the vitamin C. And you want that at the top of the ingredient list. So look at the back of the product. And it needs to be in the first 5 ingredients, I would say, to be a good quality vitamin C. And that doesn't mean it has to be at 30% to
that could be
that.
It's 15%.
Yeah, exactly. But it needs to be in the first 5. If it's towards the bottom, and definitely anything below fragrance, parfum, but
you're being ripped off.
Absolutely.
Just
but
easy
if it's
to
on
know.
the lower end, then I would say that is in there for a great story.
Yeah, money down the
really
drain.
Action. Yeah.
So look at, if you still have the packaging of your vitamin C, then you can look on the carton, because every carton has to have the ingredients list called the Inky list. And if you don't still have the carton, go on a website and look, and they have to list the ingredients and check where on that list of ingredients it's sitting. And then you'll know if it's just feeling nice or doing long-term stuff. That's what I'd say. So that's kind of, so in the daytime, in terms of serums, I mean, I just feel you could do a million things, but I think it's having a good sort of serum to add extra hydration and deal with collagen elastase, and then it's something for vitamin C to deal with damage. That's fun. You don't need anything else. No. You really don't. So for us, it would be that and that, all right? But you could be just looking at the knowledge that Claire's sharing with you to think, when I'm looking at my own things in my bathroom, do they go by those rules, or should I upgrade elsewhere? What does it look like? We do have a gifting one, which is called Something Glow. Where's that? Reveal Your Glow. And this one is, the vitamin C, and whichever one you're going to use, this is the thing that will make you go from dull skin to feeling a glow, not with a light reflecting superficial cosmetic ingredient in it, but actually fundamentally changing your skin. And this is the one in here, and it's called Reveal Your Glow, and it contains the cleanser, which is better off the AHA, PHA, so that's beginning that sort of exfoliation process. It's got the sorry, I'm going to do it in the right order. It's got Reveal Yourself, which you're going to use at nighttime. It's our stronger acid. It's got the Boost Up you're going to use in the daytime, and then it has Bounce Back. So it's just a phenomenal set. I love that set so much.
How cute are those stackable pots?
I know, I mean the pots.
I can't get enough because I think they're obviously
they're
genius.
so cute.
Yeah.
Everything is like stackable. You know, it's your
Yeah.
star set.
And we made the liquids into a bottle,
I
and then
know,
we made it like a jar.
I
So
know, it's
and amazing
just,
to travel.
Fantastic.
And all refillable.
Yeah, all refillable. So you can, once you're kind of, if you're beginning your steps journey into Trinny London, once you've finished it, you can then buy the mothership, we call it, and you can put it into there, and then you've got this permanent. You never get rid of
And
this.
literally, when you go on holiday or travel anywhere, and to have your full routine in, but look how much space you have in the bag, because it's literally nothing.
Deodorant and everything else is going to go in there.
Yeah.
It's really great. We love them so much. I mean,
I'm just so proud. That's why I go
you
on
should
about
be proud,
it. Yeah,
you should be proud.
It's
they
a great
are
one.
amazing, and they took a long time to do.
Yeah.
So little things of joy. All right. So we've done cleansing, we've done exfoliation, we've done serums for the day. We're going to go serums tonight, but let's take a few questions whilst we're here, because there's lots of you on. So let's just start off with some questions. Why does my skin sometimes seem to reject skincare when I've been using it regularly just fine? It depends what you're using, Mary. I think it's quite difficult for us to diagnose what that could be. I do think, though, that our skin changes, and I do feel that it's interesting to look at what times of year should we switch things in and switch things out. If you use the same routine throughout the year, your skin, if it's changed because it's a different season, will slightly, in a way, I can understand you're saying those words, feel that it rejects the skincare, meaning it's not working anymore. So, you know, going from... We're now in autumn, November the 21st, we're going to winter, but the electricity's coming on in the house. You know, we might have more heating in the house. The elements outside are stronger. They're different from the sun, from the summer, but they are affecting our skin differently. And we could go from, you know, kind of balanced skin to quite a dry skin because that dehydration from central heating. If you're in Australia, the same thing could apply, because I don't know which country you're from. You're going into the summer months and, you know, you could have converse. So switching things out is actually a really good one, and we could do a whole thing on it. But if you just said to me quickly, summer into winter or winter into summer, what would you be switching?
I probably would switch my moisturizer.
Yep.
Yeah, and I might switch my serum, and I'm definitely, if I'm using an SPF 30 in the winter, for example, I'm definitely dialing it up to an SPF 50.
Yeah.
Yeah.
You know what I do at night?
And I might add another step in my routine.
For winter?
Yeah.
Yeah, just like another layer of something.
Layer of something.
Can I tell you what I've actually realised I've done the last year? Is in the summer, I use Overnight Clarity.
Okay.
And in the winter, I use Overnight Sensation.
And what's your rationale for that?
Okay.
I kind of can see why.
So, all right, we're going to get on now to nighttime and retinoids. Now, how many of you, let's just start this conversation, and whilst I'm waiting for you to all type in, I will read some more questions out because I know you've left lots. So how many of you think you understand, or how many of you want to use a retinoid, but you're just so goddamn confused? That's my question. And you just need to put me and what confuses you maybe, or why you haven't tried. So I just will answer 5 questions whilst we're waiting for you to come through with those answers. Carol, I have very dry, rough skin patches on the eyelids. What can I use? This can be dermatitis.
It can be a sign of irritation.
Yeah.
It could be a sign that something in your routine is not working for you. So I would really dial back a bit and see, because it shouldn't be something that your eyelids suffer from.
Yeah.
Yeah.
And it might not be our product. She's just saying, okay,
No,
Jane.
yeah, exactly.
Jane's asking, hi, Jane. Any word when See the Light will come to Canada? I'm going to let you, in new product development, as the Chief Innovation Officer, answer that one, Claire.
Well,
Honestly.
our SPF 50 is a drug in Canada, and it's also a different type of drug in Australia. So it's taking us a little bit longer to go through the whole drug approval process. So we are working on it, and it is coming. But we also didn't want to have the full, like, not have our SPF 50.
Yeah, because
out.
we brought out retinoids and we really needed, because 50% of our business is UK and 50% is rest of the world. And we needed just to, as we had it ready, give it to that first batch of people. And I'm sorry that you're not on there yet.
Yeah.
But it's coming and we're working really
sure.
hard on it.
Yeah.
This is a good one to bring into our nighttime routine. Lisa, any tips for hormonal breakouts, early 40s? There's hormonal changes going on. A lot of women, most women are perimenopause at this stage, and your hormones are playing up. And as a result, if you've had any congestion ever in your life, it's going to pop back out. And sometimes you've never had it, and you'll suddenly find you have hormonal breakouts. And it's really debilitating. I had acne from 13 to 30. I know how much it can affect confidence having spots.
And as an adult having spots, it's like, I never had any spots as a teenager, and I had really bad hormonal breakouts.
Until you started overnight clarity. So we're going to go now through, actually, let me go here and just see what you all feel about, I'll just read out a few more. Tiptoe into Godsends changed my life and made everyone jealous of my mid-50s skins. Thank you so much, Holly. I want to use that. Can we use some of these? Please, can you put these on the website? If you love a product, could you please put on the website these fantastic reviews of our products? It's very lovely of you. There was just like, I just think, Pip, thanks Trinny, love all your skincare, thank you very much. Jane, I think Plump Up might be my desert island product, love that. Plump Up has changed my skin so much in a year, smoother, more even, love it, that's brilliant, we're still on Plump Up there. Next generation UV filter, oh yes, that's Trinny London commenting, that's great, thank you. All right, so we're now getting down to what you feel about retinoids, because I think retinoids is one of the most confusing, but one of the most transformative ingredients in skincare if used correctly. And we're going to talk about all of them. God, there's so many comments here. We will try and get back to some of these comments. So, flight tent here, love traveling with it all. Suzanne, love to hear that. Also spots, midlife spots. Oh yeah, we're going to help you. Listen up. So, retinoids are a group of different ingredients that can transform your skin, probably the most in skincare, in terms of accelerating the turnover of new skin. And
they are the gold standard. Like, there's nothing better than a retinoid.
Nothing better
in
than
skincare.
All right, apart from a SPF. I'd have to say, because if you use the SPF, you might. If you use the SPF from 14,
as in repairing the damage. Nothing better in skincare to repair the damage than a retinoid.
All right. So there's things. So we did it also. I'm just gonna do a link here. If you really want to understand retinoids very deeply, Claire did a phenomenal deep dive on retinoids, and we'll do a link to that. All right, just make a note of that, and you can go and read. But I'm going to do it so quickly. So here's the width of retinoids. In this section onwards, they're prescription. So they're already retinoic acid, and that would be Retin A. That's the classic name, and it's on a prescription, and you might be doing
Skin of Me,
Dermatica. But you might also, I did Retin A 1%, very strong, when I had very bad cystic acne when I was younger. So those are already retinoic acid, and what they're doing is they're kind of accelerating, new skin, and so trying to get rid of your spots.
But
and
if you have it, like for me, I think generally, like if you're going to use a retinoic acid in a prescription, you are going to have the downside of that, which is the peeling of the skin, the redness. And if you have a major problem, like if you have cystic acne and you will do anything, then obviously it is amazing. For people that, like you're going to have a lot of downtime, and I think unless you've got extreme conditions, it wouldn't be the thing because I think it puts your skin out of balance. It helps you with the aging, but then everything else in your skin is out of balance.
Yeah, and it means that, for a few weeks, a month, when you put makeup on, it flakes. It's just like, you don't need to be doing that. And I think we can either do nothing, like the ladies who have said, I don't cleanse my skin in the morning, or we can be going to prescription products when we don't need them. But if you're using the wrong retinol over the counter, you would think you need them because they're going to do jack shit. There's one called retinol palmitate. Throw it away. It's like shit. If it's on the back of your retinol and that's the only retinol product you got, it's doing nothing. Just saying.
Yeah, it's a super weak version.
Super weak. It's like tick the marketing
It nearly
box.
is acting like an antioxidant in the formula, so the formula doesn't go bad.
Oh, really?
Not that this
Okay,
is
my
not-
God, you're kidding.
Yeah, but
Really?
that's what you might put.
You might
things
put in actually when you want to have a long life
Yeah,
to a
it's not
formulation.
really doing, and
Yeah.
and you can make it sound great. Like I've got vitamin A, vitamin
Yeah.
C, and they have but they're just very small.
Yeah.
Like yeah.
We've got time for just one more question.
Okay, so what we're going to do now is we're going to just go through the two retinoids. Sorry, we've got to go through the two retinoids because otherwise we haven't finished the live. So, retinoids, we made two. And the reason we made two is that they do different things. So if you have a skin where you've got some dark spots, you might have had some congestion. You definitely could be in that position of the lady speaking where you've had great skin, suddenly you've got hormonal breakouts. But you need ingredients that are going to reduce inflammation in your skin, that are going to reduce the pore size, and therefore congestion will get less when your pore size has changed. That's going to do some healing with some azelaic acid.
It's going to really improve your overall texture.
Yeah,
And this is the
overall
thing
texture.
for me is the smoothness of your skin, so
Yeah.
how it feels and how it looks. So your pores become less visible,
Yeah.
your texture becomes more even,
Yeah.
you don't have any of that buildup of congestion underneath your
Yeah.
skin. Like you just get a clearer
Skin.
overall. Yeah, and that's the one thing
Yeah.
that I use overnight clarity,
yeah.
which is my favorite because it still has
And you don't
the
have a
retinol.
huge amount of lines. That's the difference. I think there's lines are the things I see the most that bug me, and this is overall texture of my skin.
Yeah, because
needs
pigmentation,
improvement.
so I have uneven skin tone, I get a bit of redness, I can have congested pores, I can just have a blotchy sometimes appearance.
Yeah.
And if I'm going to get congestion, now I don't get anything like big hormonal blemishes,
Cystic-y.
but I used to.
Yeah.
But now because I use Tiptoe In and I use my Overnight Clarity, but I don't also get like all the bumps
Yeah.
underneath my skin.
Yeah,
So it's the texture is
It's
really
not-
key.
that's so
how
true.
it
It's
feels
texture.
and how it looks
Yeah.
is really, really important.
Okay.
And also it's anti-aging, so
Yeah.
it's going to give me the fine lines and wrinkles.
Yeah. So in that, what makes that happen, they both contain retinol. So if we very quickly go, there's the prescriptions and then there's retinols, which are next generation retinoids. They work 11 times faster than retinol
And don't
with
have
an OL.
any irritation.
No irritation. They go in the skin and then they convert to retinoic acid, whereas a retinol converts on the surface and then converts inside the skin. So you get sometimes that surface redness, and there are retinols there in the market which can do that. Then you have retinol palmitate. No, then you have granactive retinol,
Yeah.
which we have also in overnight sensation. We have two retinoids in overnight sensation. We have retinol and we have granactive retinoid, which is a sort of slow working, sturdy workhorse. It's like the racehorse and the workhorse are in there together.
It doesn't directly turn into retinoic
Yeah.
acid in the skin, but what it does is it binds to different receptors in the skin, so it's kind of switching on the natural reserves that you might have,
Alright.
because your skin has these receptors that
That
really,
can heal itself a bit.
Yeah,
So it's
exactly.
kind of-
so it's a different way of triggering it, but it's gentle.
Getting your bowel to work by itself. Okay, I said the wrong words, but I don't know. But it's like, I'm just sorry.
I'm just gonna like sit with that for
Yeah,
a minute.
okay, sorry. I don't know where that
See
came
where
from.
that was,
I don't know where
going.
the fuck that came from. So that's the fundamental difference. And at night, those are really important to use.
Yeah.
Now, AHAs and BHAs, and Claire, you mentioned AHAs. We're going to very quickly, like super quickly, because we have got 5 more minutes. So if your skin is oily and you think, I want to deal with a bit of congestion, then Find Your Balance is going to reduce pore sizes, it's going to reduce inflammation in your skin, it's going to really help to clean out your skin a bit, and Overnight Clarity is going to help with the overall appearance. That's
And
brilliant.
you can always dab this one just on the spot, which
You
is
can
what I
dab
do.
that just on the spot.
Yeah.
And alternating nights, I think using them one after the other is something where you have just been doing it for years and you know your skin and you're listening to your skin. We advise alternating nightly. And if you're doing microneedling, it's acid, retinoid, microneedle, acid, retinoid, microneedle, acid, retinoid,
And it's only it's about giving your skin a break, yeah? Like,
Yeah.
if you're well trained, I always say, like, if you're going to start going to the gym, you're not
Yeah.
going to go twice a day, 7 days a week.
No, you're not.
You're going
You're
to
not.
hurt.
Yeah.
Yeah. So you want to like do the leg day, the arm day, and
Yes.
and rotate it around.
Yeah.
So it's just about being kind to your skin and giving your skin a bit of time
Yeah.
to. But what it does is it builds strength and resilience, and it absolutely does. And then over time, you can start incorporating them in the same day
Yeah.
and really getting maximum effort.
Yeah.
But like I
It
would
takes
always,
time.
it takes time,
takes time,
and I'd
yeah.
rather not knowing people's skin conditions.
Say
Go
alternating
slower
for
and just go slower.
a few
yeah.
months. Like when
Just-
we say it takes time, it is a few months.
Yeah.
It's like 3 months we love as a window. A 90-day window is that window of total skin regeneration is 60 days.
Yeah.
But it gets slow when we get older, right?
Yeah,
Okay.
it's 28 days.
Sorry,
and then
28
it gets,
days, but
yeah,
then
and
it gets slower
Yeah.
towards it. Okay, if you're like that kind of, my skin's normal, but I really want to work on the aging of my skin, then your nighttime treat is going to be an AHA, and then it's going to be overnight sensation. That's somebody who's thinking wrinkles is my thing here, and I just see the aging of my skin. So Reveal Yourself is going to be a stronger exfoliation. You only use at night. You put it on, don't take it off. And if you're looking for other AHAs in the market, all I would say, and this is my personal opinion, we use lactic and malic acid, and we use gluconolactone in this as well,
Yeah.
I think. But we don't use glycolic. And I find glycolic, which is, I think, the smallest molecule in the AHAs.
It goes the deepest,
Goes the
the
deepest,
fastest.
the fastest, but it can be abrasive on the skin. It can make your skin a bit red, and I think people can overuse a glycolic, and you get this immediate feeling of, oh, I'm polishing my skin. But I find skins that I meet that are unsettled have overused glycolic.
100%.
So we didn't want to put it
Yeah.
in. Okay,
Yeah.
all right.
I generally avoid glycolic. I think
I know,
it's too
I've
much.
stopped using
Yeah.
it in the
Yeah.
last 2 or 3 years.
Yeah.
So with all of these, you're clutching. I know that's rude for the Australians and Canadians.
Okay.
All right, so I'm going to also
Apologies.
clutch this,
Yeah.
but minimum SPF 30, and if it's available to you, a 50. There's 50s, lots of good 50s out there. So it could be Aven, it could be, who's nice people in Australia, Ultraviolet.
Ultraviolet.
Lots of brands do a great 50, but really it's the reason. Also, some people just say this without the reason, so I think giving you the reason helps you understand the importance of why you need to use an SPF 30-50 in the day, whatever the weather outside, when you use a retinoid. Over to you, Pam.
So like 90% of your aging is caused by the sun. Yeah. So if you like, and 60% I think has happened outside of the summer months.
Yeah.
So the reality is, if you just wear an SPF on your summer holidays and not
Mm-hmm.
any other time of the year, you're actually letting a lot of the UV damage
Yeah. Mm-hmm.
into your skin, which is actually going to age you faster than you naturally need to be. So I absolutely live by an SPF 50.
Yeah.
Because and a lot of people have been put off with using an SPF 50
Yeah.
because of the texture.
Yeah.
So
I'll
we
put it
worked
on now.
really hard to make a super, super light, super hydrating formula that is just the easiest thing to use. So it doesn't even feel like it has SPF, and it's
Lasting
actually
your
SPF
routine.
68.
I
So
know,
it's a
yeah.
50 plus, so that has to be over 60. So it's so easy, so nice.
We don't say 68 because in England you can only do 50 plus. But
Yeah,
it'll be
50 plus
68,
is
yeah.
the max. Yeah.
And I think the other thing I wanted to just mention, Claire, is why if you use retinoids, you must use an SPF the next
Yeah,
day.
like
If you could just-
retinoid can make your skin sun sensitive. Because it's basically renewing, so you're getting the younger skin through faster. So in the morning,
It might sort
your
of burn
skin
easier if
yeah,
it's younger
exactly,
skin.
exactly.
Yeah.
So using an SPF in the morning is kind of essential.
Yeah, so there you have it. So I hope it's given you a sense of routines and what are those key ingredients. Whichever range you go for, the most important thing I think Claire and I want to get across today is think of the ingredients, be intelligent around what are you being sold. Look at the back of the Inky list, try and figure out how high up those level of ingredients are going. There are some things where the levels can be very small and be very effective, but on the retinoids and the vitamin C's, you want to see minimums of a sort of 0.2, 0.3 in a retinoid, and you want to be able to be seeing a sort of, I'd say a 12, 15% in a vitamin C.
Yeah.
You know, 15% I'll kind of say, but you know, if you're skin sensitive, maybe at 12%, but anything under that is really just going to be chat. That's it. So I hope that was helpful. If you also leave questions at the end of what else you think you would like us to cover, what do you feel you'd like to know more about, Claire and I are here to support you on your skincare journey. And also to find out from you what you'd also love more in your routine. We have got, you know, We've got many things in the lab. The order in which we bring them out is around how long it takes them each to develop. But there are a few things which we sort of think, okay, we kind of have an idea of what we think we know you want next. But you might just want to put those things down now, just to kind of try and do the popular vote element of product
I think we always listen, like that's a key for me and my team, is that we're always watching the channels and trying to listen and see what people
they're big brother. They're always watching. Anyway, thank you so much for tuning in. Thank you, team, for supporting with questions. And please leave your skincare questions below and we'll try and get the team to answer them during the day today. All right, and the light's gone, so that means time for us to switch off. Bye.